Insomnia. It's a pandemic of our time. We have the coronavirus disease pandemic, but now, especially in the last 3 years, the frequency of insomnia has sharply increased. If earlier about 15% of people suffered from chronic sleep disorders, now about 40% of adults have either regular or constant sleep disturbances. In this video, I'll tell you why a person's stress may already be over, but insomnia can remain and last for years or even decades. Watch this video until the end and I'll give you 3 simple tips. And what should you do if you have a bad night? How do you get through it? How do you get through the next day? And in general, this will help reduce the risk of developing chronic insomnia. And now I'll tell you about 3 typical situations when chronic insomnia develops. These are actually the patients who often come to see me. A young mother, she had a baby or even 2 babies in a row, and they were restless. They kept waking her up at night. The mother had to get up multiple times each night, sometimes up to 5, to feed, calm, and put the baby back to sleep. And she was always on edge, expecting that the baby could wake her up at any moment. A year goes by. The baby starts sleeping well, but the mother continues to have trouble falling asleep, wakes up frequently during the night, has shallow sleep, and any sounds or rustling wake her up. And this goes on for 2, 3, 4, 5 years, and in fact, there is no improvement at all. Another situation, a businessman. This is also a typical scenario. You know, when serious businessmen get divorced, they sometimes divide millions, and not in rubles. The divorce process can be so complex that it may take anywhere from 3 to 12 months to complete. The person says they got divorced, remarried, have a great family with kids, built a house, planted a tree, and own a yacht. But the dream is still terrible. Thinking about going to bed stresses me out that I won't fall asleep, and then I can't sleep. So, I suffer all night, constantly thinking about something, about business and everything else. I'm constantly sleep deprived, and it's affecting my work and family life. It's become noticeable to those around me. Problems are starting in my family because I'm always irritable and so on. So, again, the problem is gone, but the insomnia remains. Well, or some really trivial things, like when someone says, I just had construction right outside my window for 6 months at night, and it kept waking me up and irritating me. The construction ended, but the insomnia remained. If you also suffer from chronic insomnia and found something relatable in these examples, please like this video. And now I will tell you about the 7 stages of the development of chronic, non-organic, conditionally reflex or so-called Pavlovian model of insomnia formation. These are like the 7 circles of hell, as in Dante's Divine Comedy. As a rule, people who develop chronic insomnia have a certain predisposition to it. It lies in what's called reactive sleep. When a person says that even in childhood or say in adolescence, before some important events like trips, exams, or after stress, their sleep was disturbed. But after the exam was over, their sleep naturally returned to normal. The person would say, yes, I slept poorly, but I'll sleep better next night. In other words, the person experienced sleep disturbance due to stress. But as a rule, especially in childhood and adolescence, there are no chronic stresses, or rather, of course, they do happen, but less often. But as a person grows up, more social and work responsibilities appear. Well, life just becomes more responsible and sometimes more difficult because children are born and so on and so on. And at some point in life, an unpleasant situation arises with ongoing stress. Well, for example, those same children who were born and constantly disturb your sleep and make it worse. Or some kind of work situation. And let's say a person doesn't like their boss, but they can't quit. Or some financial problems, issues with the health of relatives or the person's own health. That is, things that really disrupt sleep and prevent a person from falling asleep, and what the person starts to do in this situation. This is the first stage. A person repeatedly attempts to fall asleep but is consistently disrupted, making it difficult to get rest. And if a person tries to fall asleep 20 or 30 times and fails, a persistent conditioned reflex of fear of not falling asleep develops. It shows up in the fact that the person may desperately want to sleep. But as soon as he thinks about needing to sleep and enters the bedroom, the sleepiness vanishes. This is a classic example of the formation of a conditioned reflex. Why is this type of insomnia also called the Pavlovian model of insomnia development? When a reflex is formed, a person thinks about needing to sleep and the sleep disappears. As you can see, stress actually triggers first acute and then chronic insomnia in us. One of the best methods, let's say, for preventing both acute and chronic insomnia is dealing with stress itself. I recently wrote a book called Stress and Insomnia: How to Break the Vicious Cycle.
Healthy sleep in 2 weeks.
And it describes 12 consecutive steps that can help reduce your stress. And as a result, you'll fall asleep better and be less likely to develop insomnia. You can find the link to this book in the description of the video. The second stage. When a person tries to fall asleep, where are they? In bed? So, if a person sleeps well, their bed is associated with sleep. That is, even if a person who normally sleeps well doesn't want to sleep, if you put them in bed, he will doze off in 50 minutes and fall asleep in half an hour. Because for this person, bed means sleep. A person lies down, appreciating their comfortable pillow and mattress, thinks pleasant thoughts, and drifts off to sleep. But if a person has developed the reflex of bed insomnia, meaning they constantly lie in bed and suffer there, when he then lies down in bed, he thinks, this hateful pillow, this terrible mattress, the light isn't right here, there's a draft here, and the relatives slammed the door wrong over there. And just being in bed by itself causes even more sleep problems for the person. The next conditioned reflex forms, bed equals insomnia. At the third stage, the person has developed a reflex of fear of falling asleep, and the bed is associated with insomnia. And everyone sleeps in cycles, as we call them. First, second, third stage, then sleep, and then a physiological awakening. Every healthy person wakes up after 1.5 to 2 hours, which can reach their consciousness and often does. A person opens their eyes, tosses and turns, changes position, but this awakening doesn't bother a healthy person. He turns over to the other side, falls asleep, and forgets that he woke up. During our research, we can see that a person woke up 3 or 4 times a night, every 1.5 to 2 hours. We say he woke up. He says no, because these are such physiological awakenings that a person simply ignores and forgets about them afterwards. But what happens to a person who has developed a reflex of fear of not falling asleep and for whom bed means insomnia, and he physiologically wakes up after 2 hours of a full sleep cycle? What's the first thought? Oh no, I didn't fall asleep. I have insomnia. This is a disaster. This causes a spike in blood pressure, release of stress hormones, and the person struggles to fall asleep. And then he might struggle for 10, 15, 20 minutes trying to calm down and fall asleep. That is, at the third stage, awakenings during the night start to occur. Roman, and if you still didn't get enough sleep at night, is it possible to make up for it during the day? That's actually another type of maladaptive behavior. So a person didn't sleep at night, and this is something elderly people especially like to do. They eat, nap, watch television, and sleep again, potentially sleeping 2 to 3 hours during the day. And it seems like the person is making up for the lack of sleep at night, but what will happen? He'll disrupt his nighttime sleep again, and at night he won't sleep once more, and again he'll try to fall asleep during the day. A vicious cycle develops, making the situation chronic. So here the golden rule is that if you've had trouble sleeping, then, on the contrary, try to spend the day actively, and then this will allow you to feel a bit more sleepy by evening and you'll fall asleep better. If you have any questions about this so-called conditioned insomnia that I described, or if you want to share your own examples of what led to your insomnia, please write in the comments, ask your questions, I read them, and of course I will comment on your most interesting questions. And maybe this will help you improve your sleep. So, we end up having problems falling asleep and then problems with waking up in the middle of the night. As you can see, this is no longer related to the stress itself, but rather connected to the established conditioned reflexes. But at the next stage, what does a person think? I have difficulty falling asleep and wake up multiple times during the night, unable to go back to sleep. This issue is particularly prevalent among those with flexible professions. It's important to make amends for it. Well, or especially now we have quite a lot of people working with a flexible schedule, either at home or remotely. And the person starts going to bed earlier and getting up later, that's the fourth stage, and tries to make up for it. Say he used to sleep for 8 hours, but now he lies in bed for 10. But it won't work out that the person is awake for 2 hours and then sleeps well for 8 hours. This 8-hour sleep will stretch out to 10 hours, and it will become even more shallow, with even more problems falling asleep and waking up in the middle of the night. They will start to break up, and instead of 34, there will be 5, 6, 7, 8, or even 10. That means it will become less restful, with more frequent awakenings, The human brain's peculiarity is that people don't remember when they're asleep. They just close their eyes, open them, and it's morning, but they remember when they're awake. And all these awakenings, 5, 10, 15 times a night, will be remembered by the person, and they'll think, here, I had trouble falling asleep. Here, I just fell asleep, and then something like a door slammed, and I woke up. Here, my bedmate moved, and I woke up again. And here the birds started singing. Here it began to get light, and here some car drove by. These awakenings accumulate, making the person feel like they missed half a night's sleep, even if they only lost 2 hours. Accordingly, at this stage, the person thinks, I increased the time I spend in bed, but I started sleeping even less. Moreover, in this situation, a strange picture forms at first glance when the person says, I used to sleep well at night and could nap during the day, but now I lie in bed for 10 hours, mostly not sleeping, maybe just 3 to 4 hours. At the same time, I can't fall asleep during the day at all. I try, but nothing works. What does that mean? It means that the person is spending too much time lying in bed and in a way, strangely enough, is actually oversleeping. The person now spends more time lying in bed rather than taking the previously refreshing short sleep. They may have been a bit sleep deprived, but they still got up and hurried to work. And now the person even stays in bed a bit longer, sleeps, and completely loses the sense of true daytime sleepiness. He's exhausted, he's tired, but not sleepy. It's not like he sits at the computer and falls asleep or sits with a book and falls asleep. So even when a person tries to fall asleep, nothing works. And what does a person think in this situation? Okay, I have trouble falling asleep, trouble waking up in the middle of the night, and it all gets worse. I start waking up even more often at night. I try to fall asleep during the day, but nothing works. A person thinks that the illness is getting worse, but actually here's an interesting fact, and this has been confirmed by scientific research. In this situation, whether before insomnia or during insomnia, a person actually sleeps about the same amount of time on average. Sleep quality may be reduced and interrupted for those with insomnia, but when all sleep periods are combined, total sleep time is often the same or slightly more than before the onset of insomnia. So why then can't he fall asleep during the day? And the fifth stage is that the person develops this phenomenon of sleep perception disorder. The person lies in bed longer, but feels they're getting less sleep. And in some, let's say, advanced cases, a person might come and say, Doctor, I spent a whole week lying in bed for 10 hours a day, but I only slept for 30 minutes to an hour each night. Despite being extremely tired and exhausted, I still can't sleep during the day. Or sometimes a person comes and says that for months they've only been sleeping 2 or 3 hours a night, at least that's how it feels, but in reality they still keep going to work, functioning, and so on. Actually, if you really deprive a person of sleep, even cumulatively, for example, if someone needs 8 hours but only sleeps 4, that's a 4-hour sleep deficit. If they accumulate 24 hours of sleep deficit, that's 6 days of missing 4 hours each night. A person becomes unable to function, unable to work consistently. They fall asleep during activities like reading, conversing, or even eating soup, dozing off suddenly. And that's why when someone comes and says, Doctor, for months or even years, I've only been sleeping a few hours each night and I can't sleep during the day, this is exactly the phenomenon of sleep perception disorder, which is typical for so-called conditioned insomnia and maladaptive behavior, when a person spends a long time lying in bed. So what happens to a person next when they think they're hardly sleeping at all? Do they start to see sleep itself as an illness? Moreover, this even starts to change at the biochemical level. More adrenaline is produced at night and more cortisol is produced at night. The subcortex becomes hyperexcited. These behavioral things actually start to change the brain's biochemistry. But actually, it's not some kind of disease where you're lacking certain vitamins, micronutrients, or have some kind of sleep disorder. It's actually a developed reflex of being afraid of not falling asleep. And bed insomnia, then so-called maladaptive behavior, when a person stays in bed longer and starts sleeping even worse. And also negative thinking and negative forecasting, when a person thinks, oh no, this is a big problem for me, there's no way out. And this by itself, like severe stress that accompanies this insomnia, makes the insomnia even worse. And the seventh stage is what's called catastrophizing the situation. It's a kind of hypochondriac syndrome. Well, I always like to use this kind of analogy. You know, how does a person feel who has convinced himself that he has brain cancer? Well, not good, right? Despite others dismissing his concerns, he insists he has the condition, having revised his will 3 times already. So this is really already becoming a psychiatric problem when a person thinks that he's going to die from it soon. Moreover, you know how a person runs to the internet and starts reading and finds some terrible diagnosis there? Fatal familial insomnia is a disease where a person stops sleeping and dies within 6 months to a year. The person starts believing they have this exact disease. Although in reality, only about 50 to 60 cases have been described, mostly in families from Italy. Sporadic cases exist but are extremely rare, with none described in Russia so far. Doctors may not have reported all cases of fatal insomnia, leading some to believe they will soon die from the condition after reading about it. Well, just imagine his moral, physical and mental state. And if he thinks he has a catastrophic deadly disease, his head starts to hurt, his intestines start to hurt, his heart starts to hurt, everything starts to fall apart. There's even a specific diagnosis called somatoform dysfunction of the autonomic nervous system, when certain negative thoughts start to directly influence the development of some psychosomatic illnesses. For example, irritable bowel syndrome, duodenal ulcer, thyroid problems. This can cause skin problems, in particular neurodermatitis. That is, the psyche really starts to affect the body and we develop some somatic diseases. A person believes they've become severely ill and will die from it soon. So, it turns out that whatever originally triggered the insomnia has long since ended, but this mechanism of insomnia keeps making it more and more chronic, and everything just gets worse and worse. And the person can really reach a state where they practically can't function normally because of this insomnia, which, as I said, can last for years. When such a person comes to me, and then we start to figure things out and unravel this whole tangle, I explain all of this. I say, you know, if you had some kind of fatal disease and you've had insomnia, let's say, for 10 years, then you should have died from that disease 9.5 years ago. But you didn't. You had children, raised them, managed companies, just went to work, got married, and so on. Yes, of course, it's all bad, but as you can see, it definitely didn't lead to death. Interestingly, treating this insomnia doesn't primarily involve medication. I have another video on that topic. This is the so-called cognitive behavioral therapy for insomnia. Once again, if initially these are entrenched conditioned reflexes, fear of not falling asleep, bed equals insomnia, maladaptive behavior, spending a long time in bed, and negative thinking. Then, if we apply certain behavioral or cognitive techniques that eliminate these reflexes and this behavior, right now, I cure about 70% of patients in 6 weeks without sleeping pills using cognitive behavioral therapy for insomnia. Now, this is the first-line treatment for chronic insomnia in all clinical guidelines, Russian, American, and European. But unfortunately, most of our doctors still don't know about this and don't know how to use cognitive behavioral techniques and simply treat with medication. And medications don't treat conditioned reflexes. Well, imagine this. We give someone medication, yes, the person might be able to sleep, but first they'll develop another negative conditioned reflex, fear of falling asleep without the pill. That is psychological dependence. And next, if someone takes the medication for several months or years, physical dependence on the medication. But as soon as the person tries to stop, all the other reflexes remain, the maladaptive behavior remains, and it's almost impossible to quit. So, once again, I want to emphasize that the most effective method for treating this kind of insomnia is not medication, but cognitive behavioral therapy for insomnia. I mentioned that I would give 3 simple recommendations that to some extent will help prevent the development of this terrible conditioned reflex insomnia. If you've experienced stress or even a series of stressful events that have really disrupted your ability to fall asleep, the first thing is that you shouldn't stay in bed for more than 15 minutes, because lying there will trigger and reinforce the conditioned reflex of being afraid you won't fall asleep. People ask, but what about my sleep? Won't I get enough? Whether you're lying in bed trying to fall asleep or you've gone to another room to watch television or read a book, the time it takes for your brain to calm down and for you to fall asleep is almost the same. Staying in bed reinforces the fear and difficulty of falling asleep. Reading a book in another room builds up a sleep deficit. Next, you shouldn't change your wake-up time even if, I don't know, you couldn't fall asleep for an hour or 2. When working remotely, people often think I'll just sleep in for an extra hour or 2. If he wakes up an hour or 2 later, he feels rested, but the next night he'll struggle to fall asleep again, thinking he didn't sleep. This is where a vicious cycle begins. You need to get up at the planned time, even if you didn't get enough sleep. But in fact, you will accumulate a sleep elixir that will help you fall asleep better the next night. Even if you have some level of stress, because sleepiness will overcome that stress. And third, even if the night didn't go very well, spend the next day actively. Don't cancel meetings, don't cancel any negotiations, don't cancel outings with friends anywhere, because if you cancel, you'll just sit and suffer. And on top of that, you didn't get enough sleep and start thinking, why is this happening? The next night may also be bad and worse if you nap during the day, as that will disrupt your ability to fall asleep in the evening. So it turns out that you will be forming this negative mindset. And if you napped during the day, it will also lead to maladaptive behavior. Stay active throughout the day. You'll barely notice your lack of sleep. By evening, you might feel sleepier, which is better. It'll be easier to fall asleep, and you won't reinforce the fear of not being able to sleep. And these 3 simple tips can sometimes prevent the onset of chronic insomnia. Subscribe to my channel and hit the bell so you don't miss my new interesting videos.